Our trust joined the Global Comparators initiative because we have a long-standing, fruitful relationship with Dr. Foster for several years. Our Chief Executive and the Director of Clinical Governance have both been involved with Global Comparators from an early stage. The Trust is keen to develop international relations with the best hospitals so that we can share and learn from best practice around the world. The Trust chose to take part in the AMI goal because AMI outcomes are key indicators of the performance of any hospital. As an individual, as an interventional cardiologist, I chose to take part in the AMI goal because I treat people with myocardial infarction day in, day out. And it's natural for me to want to actually compare my performance with hospitals and the performance of our unit around the world so that we can do things even better. The particular challenges we wanted to address in comparing ourselves with other units around the world, first of all, is do we believe the data? We need to have confidence that the data are robustly collected, well validated, that differences in case mix are taken into account. Given that challenge being overcome, then we need to know what are the best performing units doing differently and how can we replicate it. When we became involved in the AMI goal, Dr. Foster shared the AMI outcome data with the international group. We were struck by how the outcomes were very similar for hospitals within countries, but were very different between countries. And frankly, we were very sceptical about these data, so we spent a long time analysing the data, discussing the data, querying the data.
The Coventry and Warwickshire project around the acute myocardial infarction goal was a really good opportunity to start using the tool and showcase the actual benefits and features that it has to offer. And the first opportunity I came in and we started to discuss what kind of patients are they seeing at the moment, when are they coming in, where are they coming from. So the characteristics of the patients were quite important because if we wanted to compare outcomes of acute myocardial infarction at Coventry and Warwickshire globally with other hospitals, were they similar types of patients? So the first part of the project was to truly understand the types of patients that were coming through the door, and then once we had that intelligence and information, we were able to start comparing Coventry and Warwickshire nationally and internationally to find out whether they had similar outcomes against those similar types of patients.
Well, the Dr. Foster team supported us by providing us with clearly understandable data and with the web tools to help with the comparison. Whenever we asked for any reanalysis of the data, that was given to us promptly. They also facilitated teleconferences between the UK, US and the Netherlands, and we had 2 international face-to-face meetings which were very successful. The Dr. Foster team helped me personally by putting me in touch with individuals internationally who gave me key advice and tips about what we could do.
The support programme that is offered to the Global Comparator participants is vitally important to the success and the ongoing success of this project. The toolkit that they have access to is a great repository for data, but what the support offers is how to actually extract that data and turn it into insights for them to understand the outcomes and understand the methodologies behind that data.
The benefits in outcomes that we've seen as a result in this work come really from me realising early on that the outcome differences between countries were real, and that this is despite patients across the world receiving the same basic treatment. The only difference that I could see was the speed of treatment. Our US colleagues have very robust and sustainable systems to constantly look at reducing delay, and this is something that we all know is important with myocardial infarction because the quicker that you open the artery, the less damage is done and the better the outcome. But there was no one, I don't think, who matched the single-mindedness and systematic approach of our American colleagues. At my institution, our performance has always been above the national average, and we have always thought that there wasn't very much more we could do to improve. When I shared with my colleagues what the Americans were doing, I convinced them that we could do better. So we actually took some of those strategies and put them into practice. By reviewing the data more frequently and looking at each part of the pathway in more detail, and also by engaging with the ambulance crews, we were able to actually produce a real change in the timeliness of treatment. For example, before we were treating 82% of patients within 90 minutes of arrival in our hospital, but with the changes that we made, we drove this up to 96%, which puts us firmly in the top 10 hospitals in the UK for this kind of service. And the really exciting thing is that we have started to see a fall in mortality. Now, it's too early to say whether that's sustainable, and there may be other factors at play, but we're very encouraged by these changes that we've made, and we think we're on the right track.
The overall benefit for the whole of this project is being able to discuss different challenges that different health organisations have across the country and the globe, to be able to really get a good understanding where potentially in one country they could be doing something slightly differently, but it having a profound and positive effect on the population. And I truly believe that's quite an important element that we can bring to this project.
For individuals taking part in the programme, there is the value of being able to see in detail what international colleagues are doing in their day-to-day practice, and that helps reflect and improve upon your own practice. It's also a fascinating insight to see how high quality data can drive improved outcomes on a large scale. The international collaboration with Global Comparators is helping my trust achieve its ambition of international recognition for the excellent care that we deliver, and also helping us share and learn from best practice around the world.